Jagba syndrome is the movement of people to the foreign land for greener pastures. This has no doubt affected the medical profession in Nigeria. But the Lagos government is about to find a lasting solution to the brain drain. Commissioner for Health, Akin Abayomi, said this during a ministerial press briefing on Wednesday. Senior correspondent Adedoja Salamadini has more.
It's the turn of the Ministry of Health to brief journalists on the first year of the second term in office of Governor Babajide Sanwo-Olu. For the media, their achievements cannot come without questioning.
This is the place they will always want to be. But unfortunately, from Lagos, we also move in droves.
The Nigeria Medical Association, in its statistics, says Nigeria has 1 doctor to 10,000 patients, which is a far cry from the WHO recommendation of 1 doctor to 600 patients. But what is the Lagos State government doing differently to stop the brain drain?
We have a very, very elaborate and strategic plan to establish a standalone University of Medicine and Allied Health professionals. We plan to increase the number of medical students, nurses, and other allied health professional intake several-fold in the next 2 to 3 years. The more you produce, the more you're going to be able to retain professionals in Lagos and in Nigeria.
Following the previous successes recorded with Ebola virus disease and the COVID-19 pandemic, Professor Abayomi reacted to the WHO warning about the risk of the next pandemic and the HPAI, highly pathogenic avian influenza, that is highly contagious and often deadly.
We have developed the plans, we have designed the Infectious Disease Research Institute. We did that because we learned during COVID that the IDH needs a very elaborate institution that will be able to collaborate with international investigators and be able to determine through very strict surveillance what is happening in our environment and what is happening around the world, so that we have advanced intelligence on the possibility of any potential outbreak or pandemic.
The commissioner said notable projects that are currently in construction includes the new 150-bed Massey Street Children's Specialist Hospital, the 280-bed Ojo General Hospital, the 500-bed Ketue Journey Mental Health Institute, and the 120-bed Shomolu General Hospital. He also adds that the state is committed to meeting the standard of the national target of 1 primary healthcare center per ward. Adedoja Salamadini, TVC News, Lagos.